Hey everyone, welcome back. Ready for another deep dive?
Always.
Okay, great. So today we're taking a look at something, well, a little unnerving, to be honest.
Oh, lay it on me.
The Oropouche virus.
Okay.
I'm intrigued. What do we got?
I've been going through some research, and let me tell you, this one's got some real red flags.
Red flags. Okay, now you've got my attention. What's making this virus stand out from the crowd?
Well, for starters, it's not just hanging out in, those typical tropical spots anymore.
Right, typically Central and South America and the Caribbean.
Yeah.
But I have a feeling that's not the whole story this time, is it?
Nope. It's showing up in, get this, North America and Europe.
Really?
Uh,
Wow, that's a pretty significant jump. So it's breaking out of his usual boundaries. We've got to dig into that. What else?
Hold on, it gets a little more intense.
Okay, I'm ready. Hit me.
There's some evidence coming out of Brazil that it might be spreading from mothers to their unborn babies. Mother-to-fetus transmission. That's definitely concerning. What kind of evidence are we talking about?
So two unborn babies, they didn't make it. And then another baby was born with birth defects.
That's awful. Are there more cases?
Yeah, there are. They're looking into 15 more unborn baby deaths, plus 5 miscarriages and 3 cases of babies born with congenital anomalies just in Brazil. And they've also found a case of congenital anomaly in Cuba, and they're investigating 2 more there.
Wow, that's a lot. We need to understand what's going on there. But before we dive into that, I think it's important to clarify that this virus isn't just a risk for pregnant women, right?
Right, exactly. Anyone can get infected.
So let's talk about those symptoms.
Oh yeah, they're not pretty.
I was reading they're kind of like a really nasty flu.
Yeah. Fever, headaches, your joints all ache, chills.
Nausea, vomiting, the whole 9 yards.
Ugh, sounds miserable.
Yeah.
And to make things worse, in a lot of cases, like up to 60%, people get hit with a relapse.
Oof. So just when you think you're in the clear, it comes back to bite you again. That's rough.
It is. And here's the real kicker. There's no specific treatment.
No vaccine either, right?
Nope. Nothing. So prevention, that's our best bet right now.
Absolutely, especially since we're still learning about all the ways this thing can spread. I mean, we know about the midges, but mother-to-fetus transmission, that's a whole other ballgame.
Yeah, it's a puzzle they're trying to piece together. And this whole thing feels a lot closer to home when you consider that there have already been cases in the U.S.
Oh, right, I was reading about that. 94 imported cases, wasn't it?
Yeah, spread across 5 states. Florida, California, Colorado, Kentucky, and New York.
And 3 of those cases ended up in the hospital.
Yeah, not good. And it's not just the U.S. either. Europe's seeing it too.
30 imported cases, mainly in Germany, Spain, and Italy. It looks like most of those folks had been to Cuba, and only 1 had traveled to Brazil.
So Cuba might be a new hotspot.
Possibly. Researchers are still tracing the connections. It's like a global detective story.
It really is. Makes you wonder, what can we do to protect ourselves? Especially with no cure on the horizon.
Prevention, prevention, prevention. It's all about minimizing your risk of getting bitten in the first place. Think of it like wearing the right gear when you're hiking in tick country. You know, long pants, tucked in socks, bug spray.
Right.
Same idea here. Mosquito nets, those plug-in repellent things, clothes treated with permethrin, and good old-fashioned bug spray can make a huge difference.
So basically, be aware, be prepared, and don't skimp on the mosquito repellent.
Exactly.
All right, but let's zoom out for a second. With all this global travel and climate change potentially shifting where these insects live, what does the future hold for Oropouche?
Well, if it's already popping up in places we didn't expect, imagine what could happen if the midges that carry it expand their territory.
Because of, like, warmer temperatures and stuff.
Yeah, or changes in ecosystems. It's something we really need to be thinking about and planning for.
Yeah, absolutely. Okay, so for everyone listening, take a moment to think about your travel plans, your local environment, and what steps you can take to stay safe. This is a serious issue, but we can tackle it head-on with the right information.
Could agree more. Knowledge is power.
So stay curious, stay informed, and until next time, happy deep diving.